Hello, this is Dr. Do again. This video is still on alphabetic list problems. Today I'm going to talk about one condition which is associated with many diseases, and it's called palpitation, which means increased heart rate. I think I had previously video on the arrhythmia mentioned about the palpitation, but today I'm going to layer it out for different age group. What are the common conditions that cause this palpitation? What kind of palpitation you might manage at home through simple maneuver, or what kind of palpitations you really need to see the physician. So let me just bring up the first emergency situation. What kind of palpitation that you really need to see the emergency room right away. Usually palpitation for those older people with pre-existing factors, pre-existing diseases. If you suddenly feel the palpitation, particularly if this palpitation associated with the chest discomfort, even though, of course, chest pain, that not even to mention, but even though it's not a pain, but just that the palpitation make you feel uncomfortable on the chest, or make you feel like a blackout, alter the mental status, or the palpitation with severe sweating and even to the palpitation interfere with the breathing, feel gasping for air. So all of those increased heart rate is really kind of emergency situation. Go see the physicians as soon as possible. Can you manage at home? Depends on the palpitation. For example, many causes can cause this palpitation, like dehydration, particularly older people, or the fever. So if that's the case, I'm going to talk about that. Probably you can manage at home. But let me just layer out for the age groups, stratified into different ages, what are major causes for the palpitation. For the children, the infant or newborn, for example, the palpitation is not a sign, alert for the newborn. It's not a sign to alert for some diseases, because the infant heart rate is 160. It's really fast, can reach to 160. However, for the newborn infant, if the heart rate lower than 100, that is a sign for emergency, or that especially if the baby turn blue, feel cold, or like stress of sucking the milk. So that is the case for the emergency. And for the children, the major cause of palpitation is the fever. Either viral or bacterial infection cause the fever. So it depends, but regardless, if the children are younger than 5 years old, this increased heart rate, high fever, cannot brought down by the medications or associated with other symptoms, particularly if this bacterial infection caused the fever, the child look more sick, lack of energy, do not want to do anything. So if that's the case, you really need to see the physician, or even though it's not emergency, but you really need to see the physician. I think I've mentioned many times. So the palpitation, one of the most common cause increased heart rate in the children is the fever, particularly the viral infection or bacterial infection. So need to be seen by the physician to check it out, to exclude the bacterial infection, to confirm it is viral, through the supportive care. So that's for the children. For the adult, young adult, healthy young adult, the palpitation usually is imbalance between the organic and inorganic. It's a inorganic disease, which means it's not a really disease, just imbalance of the sympathetic or parasympathetic conditions, or stress, or lack of sleeping, or dehydration. These are one of the most common cause for increased heart rate in young people. So if that's the case, then you probably know how to manage, or sometimes change the position. There's a maneuver you can try, but has to be gentle. This is referred to the healthy young people without family history of heart disease, without diagnosed any disease, without any other conditions, just the palpitation. You can try it. Under your chin, there's a narrow area. You feel the pulse, and then you massage there gently. Or you just probably make a deep breath, hold it for a couple of seconds, and let it go. See whether it can improve, or drink some fluid, or take some, or sleeping, or whatever. If it doesn't improve, if you feel like you're going to black out, even though it's probably not a disease, but still probably it's a good idea to get it checked. And the other, actually, this is the reason, because for young healthy people, the palpitation may be caused by the thyroid disease. Because the thyroid hypothyroidism could occur in young healthy people, particularly either male or female. If you have this palpitation associated with this hot flush, eating a lot, and feel moist in your hands, and if you close your eyes, reach your hand out, it's shaking, so that's probably the palpitations caused by the thyroid disease. So that is the case. You need to see your physician to diagnose or to exclude. And this is for the healthy young people. For those young people with known pre-existing cardiac conditions, any change of heart rate, either palpitation or decreased heart rate, you need to see your physician to get it checked. Probably the disease is getting progress, either worse or there's some other complicated conditions. You need to check it. For the later adult or older adult or older people, the palpitation is particularly the new onset of palpitation for the older people without known conditions. Without knowing under stress, without knowing dehydration, that's probably indicating some heart conditions. Regardless, I think you need to get it checked. Even though probably it is caused by the dehydration, or because of the stress, or because of lack of sleep, or because of subtle urinary tract infection, but still it's a good idea to get it checked. Make sure it is caused by this group of not serious condition, but has to be excluded just in case if something happened. Because even though you do not know you have hypertension, even though you do not have any other disease, but degenerative change may have this palpitation from the heart. The heart valve, for example, undergoing some changes cause of the subtle palpitation as first presentation. Even though it's probably not common, but still it's good to get it checked if you have this unknown cause of palpitation. And for those people who has pre-existing or comorbidities, change the heart rate from regular or even though you're taking the medication such as beta blocker, calcium channel blocker, and the heart rate changed. So that means either the medications not need to be adjusted dose, or need to change other medications, or probably there's some other serious problem going on. So check with your physician. So this is about the palpitation. Seems quite common, and I have mentioned so many times. But this video is just layer out as different age group. What are the serious conditions? What are the common causes? So hope it helps, and thank you for watching. I will see you next time.